So I'm working with Dr. Eva Feldman in the field of diabetic research and how diabetes and metabolic disease causes peripheral neuropathy. In our laboratory, we mostly use animal models to kind of investigate disease as we can work on humans. And typically, our models involve feeding mice a high-fat diet. And what this does is that the mice develop a lot of the hallmarks associated with diabetes and obesity, and more importantly, they develop a peripheral neuropathy, which is what we are aiming to understand and investigate. One of the things that I'm more recently working on is looking at differences between male and female mice and how they develop this peripheral neuropathy in the setting of metabolic disease. Interestingly, from the literature, female mice, when they're fed a high-fat diet, are resistant to developing a lot of the metabolic abnormalities associated with disease compared to the males. And this is attributed to the way females have different distribution of fat and how the sex hormones, estrogen, has a protective role in prohibiting the development of these diseases. So based on this kind of on this previous research, we anticipated that female mice would not have as much of a neuropathic phenotype as their high-fat fed male counterparts. However, when we did the neuropathy phenotyping, we discovered that even though the females who appear to be normal compared to their high-fat male counterparts, they still develop neuropathy. And this leads us to believe that one of the insulin resistance, which was once thought to be a contributor to development of peripheral neuropathy, is not actually a driver of the disease, and that there are other mechanisms in play. So what we're doing now is confirming the role of insulin signaling in the peripheral nerve, and while also looking at other mechanisms that contribute to the disease, such as dyslipidemia, where you have an abnormal level of lipids or fat in the system. And so all of this is being performed with translational therapies in mind, so that we can bring this from the bench to the bedside.